Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. The Central Bank of Nigeria reaffirms its commitment to fund the production of vaccines for infectious and communicable diseases in the country. Bauchi State Ministry of Health intensifies efforts at flattening the COVID-19 curve in the state. And a coronavirus vaccine developed by the University of Oxford shows promise as UK orders 190 million doses of different vaccines. Let's begin. According to the Nigeria Center for Disease Control (NCDC), 11 deaths were recorded in the last 24 hours in 4 states, 6 in Edo State, 2 in Ebonyi Plateau, and 1 in Adamawa State. In 24 hours, the center announced 556 new cases of the virus recorded in 17 states and the Federal Capital Territory, with the total cases now standing at 36,663. 15,105 patients have recovered, while the death toll is put at 789. Of the new cases, 4 states recorded the highest of the new infections, above 50, and the FCT, Edo, recorded the highest of 104 cases, followed by 97 cases in Lagos, 70 in the FCT, 66 in Benue, and 61 in Oyo. 13 other states recorded below 50 confirmed cases. The top 5 states in Nigeria with more people on admission include Lagos, the epicenter, with 11,298, the FCT, 2,105 cases. Oyo State has 1,031, Ondo 761, Delta is at number 4, managing 756 cases, while Edo has 701 patients in its treatment centers. And from the continent of Africa, while the relatively low number of coronavirus cases in Africa so far have raised hopes that African countries may be spared the worst of the pandemic, it is not yet Uhuru. Latest coronavirus figures show that the continent now has 721,871 cases, of which more than 380,000 people have recovered, and the death toll is over 15,000. South Africa still has the highest number of cases in Africa, 364,328, followed by Egypt, 87,775, and you have Nigeria at 36,663. Ghana is 4th with 27,667 recorded cases, followed by Algeria, seen at 23,084. In the meantime, the countries with the most fatalities are South Africa, next is Egypt, Algeria, then you have Nigeria and Sudan. Many countries in Africa have varying degrees of lockdowns, partial lockdowns, bans on large gatherings, curfews, and also border closures to stem the virus. South Africa, Cameroon, Mauritania, and parts of Nigeria have launched massive community door-to-door campaigns to screen people and identify potential cases for testing. Now, the coronavirus pandemic has exposed the weakness of the nation's healthcare system, calling for a quick intervention to change the narrative. And this is why the Central Bank of Nigeria is reaffirming the bank's commitment towards the provision of grants to finance activities of research institutions for the production of vaccines for infectious and communicable diseases. The governor, at an inaugural meeting of the body of experts of Health Sector Research and Development Intervention Scheme in Abuja, explains that out of the 100 billion naira earmarked for healthcare intervention by the bank, over 26 billion has so far been distributed for healthcare projects across the country.
The Central Bank of Nigeria initiated the Healthcare Sector Research and Development Intervention Scheme. The program is designed to increase the nation's research and development activities that will help support the development of Nigeria-made vaccines, drugs, and herbal medicines. Through the provision of grants to biotechnological and pharmaceutical companies, institutions, researchers, and research institutes, our domestic capacity to curb the spread of COVID-19 and other communicable or non-communicable diseases will improve. We expect that these grants will be channeled by these institutions to fund research and development of drugs, herbal medicines, and vaccines for the control, prevention, and treatment of infectious diseases.
Well, over in Bauchi State, our correspondent Niger brings us the latest on the coronavirus situation update from the state.
As of today, Monday, there are only 10 active cases of COVID-19 at the Bauchi Isolation Center. And most of these cases are from active case search in communities. The Bauchi State COVID-19 Committee has gone into 17 communities in Bauchi local government area. The local government area happens to have over 50% of the total number of confirmed cases of COVID-19 in the state. For now, the curve seems to be flattening, but the Commissioner of Health says it is not yet time to celebrate, and this is why they have gone into the communities for active case search. The target is to test 10,000 people in the communities, and for now there's a challenge, and the challenge is the shortage of reagents for testing. The shortage may slow down the pace at which the testing is being carried out.
Currently, we have gone into community mass testing. So we are doing active search now. We have developed the protocol as well as the consent, and we are going deep into the community. And as you can see, we started last week, and out of the initial 250 samples taken, only 2 came out to be positive. And we tested again about 350, 7 came out to be positive. So when you look at the total sum of more than 600 samples to 700, we got only 10, which shows that the contact tracing activities that we have been doing in the state has been very effective. So we are hoping that by the time we do more testing, it will give us a guide whether our curve is flattening or we are still at the peak of the pandemic, because it varies from state to state. As I'm talking to you that in Bauchi, we are flattening. But this flattening is not yet uhuru, because anything can happen.
Since the outbreak of COVID-19 in Bauchi State for over 4 months now, 529 confirmed cases have been reported, and there's a recovery rate of 95.6%. From Bauchi, Hajera Aliyu for COVID-19 updates.
Well, in Niger State, our correspondent Simon Emperor breaks down the cases from the Emergency Operations Center in the state, where he says of the number of confirmed cases, 78% are male, 22 female. He also reports on the spread of the virus majorly in the local government areas.
Based on available statistics to us from the Emergency Operations Center, Niger State currently has a total of 155 confirmed positive cases of COVID-19. Now, out of that figure, 112 have been discharged, 7 deaths have been recorded, and 7 persons are said to be on admission at the Quarantine and Treatment Center in Mina. 20 of the affected persons, representing 15%, are said to be doctors or medical health workers. In terms of gender spread, 78% of the affected cases are male, while 22% are female. We also see that in the area of local government spread, Chanchaga local government, which is situated in the heart of the state capital, Mina, has the highest figure of 71 affected persons, while Suleja currently has 19 confirmed cases. Bida local government area has 17 confirmed cases, while Kontagora has 14 confirmed cases. That's the update from Niger State. Emperor Simon for COVID-19 update.
Thank you, Simon. Now, Joseph Ehimidu, a professor of pharmaceutical microbiology, Faculty of Pharmaceutical Sciences, Ahmadu Bello University Zaria, joins us on the program via telephone. Welcome, Professor. We'd like to begin by asking, the Central Bank of Nigeria is increasing its funding for research and other diseases interventions. Is there a prospect or like a working treatment regimen to reduce the fatality rate of patients? Are you optimistic of, what this funding can do as we fight the pandemic?
Please, can I speak louder? It's not clearer.
Okay, I just wanted to repeat that the CBN has introduced more interventions in terms of research and vaccine interventions, treatment interventions as well. If you're optimistic as to what this funding does as we battle the pandemic.
There is optimistic that we are going to overcome it in the light of research being conducted globally. As for in Nigeria, for now, we are not yet there. The experiments being conducted by treatment, the PTF have supported, the result is not yet out. Even the one that is mentioned by way of vaccine in Oxford University in London is still a preliminary result at stage 2. And it cannot be confirmed. Even if they say they are going to high volume productions of that vaccine for now, I doubt whether the federal authority in UK will approve it for use because it has not conformed with the standard expected before a vaccine or any drug of that nature is approved. But for now, every indication from research being presented are showing that we will soon overcome the problem. But we still have a long way to go to be able to get data that convince beyond reasonable doubt that this problem, we have got the tool to arrest it. But for now, we are all hoping that the result being presented will give us valid tools to be able to solve the problem later.
Do you see any homegrown solution coming from Africa? And this is looking at perhaps the case of the COVID organics. The National Institute of Pharmaceutical Research and Development says the scientific evaluation of the drug from Madagascar revealed that it lacked potency against COVID-19.
Thank you very much for this beautiful question you just asked. In the other interview that was granted by your channels, I appreciated Madagascar for their brotherlyhood by giving us the COVID organic. But it's just like a herbal preparation given to Nigeria. It's a slap under the scientists in Nigeria because when it is given, the leaflet as to the content, as to the efficacy of what they supply, was not given. And if we are to revalidate it in Nigeria, on what platform are we evaluating it? What is given to us, just like a herbal preparation somebody gives to Nigeria and asks us to use it. As a scientist in pharmaceutical world, we are all very much aware the Artemisia annua they are talking about contains some components that can arrest virus. But the information supplied by Madagascar has not given us a clear value as to the level of arrest that the product has achieved. For us to be also, okay, we want to validate what they are claiming. So it's just like a herbal preparation they give to us. If Nigeria government really wants us to work, it's got the support with the private partnership and ensure that enough money is given for this research to be done. We have competent hands in Nigeria that can do this. As of course, NAPRID have shown that we know what it takes. Unfortunately, the supplier of that public organic will not give valid information to back up the product they are giving. And for that reason, to us, it's just like a herbal preparation they dump to Nigeria. It's unfortunate that this is happening in Nigeria, where we have several universities with adequate manpower that ought to be supported to get it done. But nonetheless, we are going somewhere with what they have given us. We can build on what we know. Because ordinarily, like in ABU, in Iru, what they supply us is already known and it has already been used.
All right.
Because it's the symptom. It's the symptom they are claiming they are treating, not the actual thing. And if they claim they are treating the virus, they have not given us the value, the level of efficacy of their product.
Thank you, Professor. So we need scientific backing to any claim of efficacy on any drug so far. We'd like to thank you, Professor Joseph Ahimedu, Professor of Pharmaceutical Microbiology. Thank you for joining us on the program. Civil servants in Kaduna State resumed work today following the directive of the state government after a 4-month stay-at-home order as a result of the coronavirus pandemic. The main gate of the Secretariat, which had been shut following the closure of the complex since March 26, reopened for activity. Last month, Governor Nasser El-Rufai had indeed approved a phased and gradual easing of lockdown measures with the reopening of places of worship, hotels and some other private businesses.
All permanent secretaries, directors general, chief executives of agencies and parastatals are supposed to be reporting to their duty posts, that is offices, from Mondays to Fridays, from 9 a.m. to 3 p.m. And officers on grade level 14 and above are also to be coming to office on Mondays, Wednesdays, and Fridays, 9 a.m. to 3 a.m. And we've been having our management meeting virtually all through. So this is a very good one that we will now continue. But we will strictly apply the guidelines for continuation of our work.
Well, I'm excited to be able to be part of those that are among the living, to be able to report and work today. But although we've been enforcing the lockdown order through our various mobile courts across the state, but then to be formally be asked to come back is elating. I'm elated, and I'm sure my colleagues too will be. We are back on the beat. We'll soon start going to court. The court will soon open and so on. And you can see that papers have started flying back.
According to the World Health Organization, 33 countries in the region are experiencing community transmission. It said the increased incidences of importation of cases from affected countries within the region are largely by long-distance truck drivers and illicit movements due to the porous borders. Now, the Presidential Task Force says the high-burden communities in Nigeria, with over 51% of the virus spread, is in 21 local government areas. We have Dr. Felix Oyari. He's a consultant community physician, the Department of Community Medicine, University of Abuja Teaching Hospital, Gwagwalada. He joins us from our Abuja studios. Thank you for joining us at this time.
Thank you for having me.
All right. I'd like to begin by asking...
Thank you for having me, yes.
Thank you. We are keeping track of the community spread of the virus and how you think we are fighting it at those levels.
Yes, this community transmission is the serious part of the pandemic we are fighting. I want to remark that in containing communicable diseases, there are 3 points of a triangle called the epidemiological triangle. There is the reservoir of infection, that is where the infective organisms are. And there is the route of transmission, how it gets to the susceptible host. And there is the susceptible host that needs to be protected. Now, what our emphasis is now is how to disrupt the transmission from person to person through droplets and so on. And it's at a community level. We are going on well, but you know, there's a lot of denial. People at the community level do not believe, and there are so many factors responsible for this, and we shall discuss it later. People don't really believe Many people don't believe in COVID. Many people don't believe it is real. And so there's a lot of denial. And we need to do a lot more work in persuading or convincing the people that COVID is real. And that is the more important thing we need to do at the community level. Otherwise, we cannot succeed much.
So you're saying that some Nigerians are trivializing the issue of COVID-19. What are some of the measures that you think, or rather, let's start with what it is you're hearing, that they do not believe it exists or they do not believe that they can get it? What are some of the responses you've been getting at the community level?
The responses we are getting, people believe that once anybody dies, it is labeled COVID. And they have known people that were sick. They've been sick before this period of COVID. But when those people became more sick or they die, people, they are labeled as victims of COVID-19, making it difficult for them to believe that COVID is real, because if they know people that have been sick before, and now they are sick as they usually were, and they go to hospital, they were rejected, they go to hospital, they were rejected, and they keep running around facilities and rejected, and eventually they die. And it is said they are killed it is because of COVID. Then it gives a lot of doubt in them to believe that actually there's COVID. They believe that we are using COVID to make money. That's the belief. Again, is that they believe that that people have had catarrh, people have had cough, people have breathlessness from other causes. What is special about this one, that once somebody has cough or has fever or has breathlessness, either from congestive heart disease, from so many other things, from obstructive airway disease like asthma, then the person is stigmatized. Hospitals reject the people and they eventually die. This is the greatest problem we have to solve, to convince them that, because again, they say they don't see the results. When people are tested, they are to be shown the results. Relatives are supposed to be shown the results. People are supposed to see the result that this person was tested positive. But once the result is not there, I have seen people ask me, tell us who you say, who are the people, when they say in community A, 3 people were tested positive. Who are those 3 people? Name them, we want to know them.
All right,
And
Dr.
sometimes
Oyari.
this is shrouded in mystery, in secrecy. They are not revealed. But I know there are medical reasons why secrecy should be kept and privacy.
So it's a lot of
should be kept
perhaps
also as a doctor, but
Dr. Oyari, it's a lot of work, a lot more work for the agencies
Yes.
responsible in this enlightenment, but we'd like to thank
Yes.
you. Thank you so much for joining us. Dr. Felix Oyari, a consultant community physician, Department of Community Medicine, University of Abuja Teaching Hospital. Thank you for joining us.
thank you for having me.
The race for a vaccine against COVID-19 received a boost today as Oxford University announced its vaccine called ChAdOx1 nCoV-19, which could be deemed safe and triggers an immune response against the virus. It reported trials involving 1,077 people given injections that let them making antibodies and T cells that can fight the coronavirus. It says the findings are hugely promising, but it is still too soon to know if this is enough to offer protection, and larger trials are underway. Continue to spread the word, not the virus. Our website, channelstv.com, has the latest update on the pandemic and several other stories as well. All you need to do is log on at channelstv.com and access the news at your fingertips. And that's the COVID-19 update program. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.